Hi, everyone. Dr. Anup Kanodia from KanodiaMD, and I've got Dr. Dr. Carine here from Carine Pediatrics. And you know what I want to start with? And also, and again, people who, hey, Brian, nice to see you. People in the chat box, please just say hi so we can, so you see where the chat box is and you can be interactive. And then also the chat box, if you guys have kids, tell us their ages. So that can also help us figure out what to talk about here in terms of age ranges. And we're going to mostly talk about pediatrics here. So Marcella has a 3 and 6-year-old. And so why are we talking about pediatrics and sleep? I found some good information about this, and I'm just going to give you just some information. Is that they're finding about up to 50% of children, have issues with sleep, and 40% of adolescents have issues with sleep. And it's kind of interesting when I look at why is sleep so important. It has direct effects on happiness, alert, and attention, brain performance, mood, vocabulary. Maybe I needed to sleep more as a kid. Learning and memory, and even in early infancy, they talk about growth. And maybe that's why I'm 5'6". Okay, so toddlers.
Still taller than me.
Yes, and I'm still growing in my head. The napping is important for toddlers for memory, execution function, and motor skills. What's interesting is what happens when our kids don't sleep. And I think this one is kind of interesting. They're saying that when people have a lack of sleep, it can mimic ADHD. So rather than putting kids on Ritalin, maybe get them to sleep more. Also they're finding that that they have more allergic rhinitis. So rather than taking Zyrtec or Allegra, do some of that. Better immune system. People who don't get enough sleep, kids, anxiety, depression, weight gain, obesity, diabetes, high blood pressure. And in adolescence, their school performance goes down and their mental health goes down. So you can see that not sleeping as kids really affects them from head to toe. But what's not in this article, and I'll put this article in the chat box for people, is also how it affects parents. When kids don't sleep well, parents don't sleep well. When parents don't sleep well, the whole house is not organized. And so I think sleep's an important thing for the whole family. So now let me, that's the segue in terms of Dr. Carine here, the superstar Carine. And so again, she's the owner and founder of Carine Pediatrics. Good name. Mine's KanodiaMD. So we are on the same wavelength there. And her bio, she has a passion for integrative medicine and osteopathic care. And that's kind of interesting. Manipulation and sleep. I think I'd like to get into that today. And I'm serious, right? I think that's a great thing that we don't think about. So as an MD, I don't do any manipulation. But as a DO, you and your colleagues will be doing some manipulation, which may also help. And that she is an advocate for changing the structure of pediatric primary care to make the whole nation, whole world better. She enjoys teaching students, other physicians through speaking, preceptorship, mentoring, writing, and I even believe even making supplements, as Orthomolecular says. But Dr. Carine, please add anything else about your bio that I did not say.
I think the biggest thing is over the years, I kind of say things I didn't choose the path I went. The path kind of chose me in some regards, but I did know what I wanted to do younger than most people. So when I was 16, I said I wanted to be a pediatric osteopath, which is really interesting. I don't know very many people who know exactly what they want to do when they're 16 and then do it when it's so obscure, but that was it. I had a mentor who was excellent, but did not do primary care. And it was really going forward, assuming that I would someday fall into a more alternative medicine practice, that I assumed I would be in a cash-based, kind of like you are, Dr. Kanodia, in kind of practice, but it really bothered me that I couldn't do prevention in that with children, that people really sought care once their children were very sick in those models, and that if I really wanted to make a dent in pediatric wellness going forward, that I really needed to see those babies from birth. The kids that we were taking care of in my primary care office, where we were combining osteopathy, purposeful development, nutrition, vitamins, and really just very careful care. I mean, some of it is just being more careful with what we do, spending more time, that the outcomes of those patients were so much better. We even pulled data when Kasich was governor out of my office in a state grant that looked at autism rates and asthma and allergies and all those kind of things. And the numbers were staggering. But as a outpatient clinician, the researchers kept telling me that like I had to be in academia to like really publish that research. So that was a little frustrating. But it really solidified for me the importance of what we do, which is starting early, identifying things really early and intervening and helping parents walk that path, because it can be very overwhelming. I mean, you want to do what's best for your kids, but you're not quite sure. And the majority of the medical community will make people kind of feel like doing anything other than normal is, dangerous. But then 80% of parents are choosing supplements and things for their kids. So clearly the parents are out of sync with the pediatricians, and trying to help parents navigate that and find some common ground that's more reasonable and safe for children. So it's kind of where my heart is. And so we have 5 nurse practitioners now, and care for kids from birth, do a lot of purposeful developmental work. And honestly, I agreed to do this sleep thing with Dr. Kanodia because I think it touches on so many aspects of our lives, so many aspects of the care of our children and their future development, that in our office, it's like, hi, nice to meet you. Let's talk about your sleep. So it's always step one in caring for our patients. So really important.
Awesome. Thank you. Is there a little feedback or no?
Are you hearing the fan from my furnace, my HVAC system, maybe?
Maybe, but we'll see.
Okay.
And so now you mentioned about your office being the unique structure, and I think you went over that. But please talk about more how you're saying pediatric sleep and in your office, and how we should be doing good care for that on that aspect of it.
You can have 2 separate kinds of patients: the patients that we know from birth and the patients we meet when something happens later, something that they come to us after having failed whatever. I always say I'm like, gather refugees from other places sometimes, families without a home because they feel like they need to find some new place. And so those are kind of managed a little bit differently. We can talk about both of those, but certainly if we're meeting a child from birth, a lot of times what we're talking about when we're talking about a 5-year-old who doesn't sleep well, probably a lot of the foundations of that were missed in infancy. So I just think that we need to work really hard with our infants, if we can, to prevent us having troubles when they're 3 and 6 and 8. Because I think a lot of the foundations of good sleep are in infancy.
Yes, so let's talk about this. We have a question from Marcella about melatonin and sleep for kids. So what is your thoughts about that?
So melatonin is interesting. I think what a lot of times people kind of misunderstand about melatonin is it is part of our natural system. So we have our circadian rhythms, and we release different things at different times. We release cortisol to wake up, and we release melatonin to help us go to sleep. We also do desmopressin at the same time. And if you do really good sleep hygiene, your children should produce their own melatonin if they go to bed at the same time every night. So the first step of sleep is always to do good sleep hygiene. And sometimes we use melatonin for short periods of time in kids that need to reset their sleep hygiene. But ideally, your child's brain should make their melatonin on their own, and you shouldn't need that. What I've noticed through the years is that there just seems to be some children that legitimately do really great sleep hygiene, and their parents do everything just right, and their children just have what we would call a sleep induction disorder, where they lay in bed and lay in bed and lay in bed, despite the fact that their parents are doing sleep hygiene well, meaning that they're going to bed at the same time, they're reading them a story, they're tucking them in, and we'll talk about that a little bit more, and they walk away and they just can't go to sleep. And in those children, sometimes there's underlying biochemical things that we can work on, but I certainly think that replacing the melatonin they're clearly not manufacturing is perfectly safe. What's not safe is if you don't practice sleep hygiene and you eat crap all day and you don't take care of your general wellness, and then a parent says they're going to like kind of wallop their kid down at the end of the day with a big dose of melatonin, like 5 milligrams or something, overcome the fact that they have made a debacle of their overall health. That would suppress a child's innate ability to release melatonin, so you wouldn't want to do that. So when we are replacing something that is obviously not working on its own, I'm perfectly comfortable with it. If we're using it to substitute some of the basics of sleep, then I'm not comfortable with it. So.
Makes total sense. And would you mind if I chime in a little bit too?
Sure.
So melatonin, like you're saying, is an amazing hormone. And the best way to get melatonin, like you're saying, is turning it off in the day, having it high at night. What we find is, at least for most adults, is that most adults don't get enough outdoor light. Getting outdoor light, even if it's cloudy outside, shuts off your melatonin. What happens is, and what do you need? You need about a 1 hour a day of outdoor light. And the best is first thing in the morning. When you get outside first in the morning, that's shutting off your melatonin. And guess what happens? You then have more melatonin at night to then actually make your melatonin. And I'm probably stealing some of Dr. Carine's punch here, but in terms of what's the easiest way of the body making melatonin is not having light pollution. And one of the things we've heard about the phones, the TVs, but what most of us don't think about is our lighting. These light bulbs, all the normal light bulbs, inhibit us from producing melatonin. So if you use candlelight half an hour before bed, or those special low blue light bulbs, you actually produce melatonin. You're not having the light pollution. So I love what Dr. Carine here is saying, is that yes, you use melatonin, but you have to use all these other things first. And sometimes it's daily hygiene that then you then say, add this in. And then there's also different types of sleep issues. One is a low melatonin. And Dr. Carine and I, we can actually check melatonin levels. I actually check melatonin levels on the patients. And if it's low, that makes more sense to give it to them. But if your melatonin is high, it may be because of stress or something else going on. And that's just something else you'd have to do for that. If they have high cortisols, you treat the cortisols, not melatonin. So I think that melatonin is a part, but all the other part goes in first. Now it looks like we have a 2-year-old, a 6-year-old, 4-year-olds. We have that age range. And for other people that are listening today, if you have kids, please write down in the chat box how old your kids are, so that we can then start thinking about that, tailoring things to the people who are listening and watching today. And Dr. Carine and I thank you guys for both being here. But let's start with something, let's continue with something simple. How much sleep do we need for different ages?
So, little kids, little babies, it feels like they sleep all the time. I always chuckle with moms that have like 1-month-olds or 2-month-olds. They're like, this baby thinks really hard. And I inside my brain, I think, oh, they sleep almost all day now. Wait till they don't. So it's normal for a baby to sleep of almost all their sleep-wake feed cycles when they're babies. So they sleep a lot, as infants. But as we go into like the years of 1 to 2, kids are going to start sleeping like 16 hours a day, 14 hours a day. Elementary school children really do sleep anywhere from 10 to 12 hours a day, and that should be normal for them. And so that notion of like you go to bed at 8 o'clock on a school night in elementary school and you're up at like 7 in the morning or 8 in the morning, that would be normal. That's why a lot of elementary school kids' bedtimes are around 8. And then, I think the big thing for teens is they way undersleep. They really do need 8 to 10 hours of sleep a night. They usually don't get that. And really for adults, which is the other big part of this whole thing is, adults need 8 hours of sleep a night. I mean, there's some variation in individuals, but when I have a parent who says to me, I do fine with 5 hours or 6 hours, no, there's just not a lot of data to support that. That most people do need a lot more than that. Because when you're sleeping, and this is an interesting osteopathic thing that a lot of people don't know, there's lots of things you do. You process the things that happened in a day. I like to say it's like your secretary took my charts and put them away in a folder back when I had paper charts. And if you don't sleep good, it's like they're just all messy again. It's hard to access the information that you learned that day. So you use sleep to organize the things that you learned. And of course, in pediatrics, we're learning new things every day, really important things. And so they really need that time to kind of take what they learned that day in their development, file it away, put it away for later. What will they, what will they do with that information later? But for adults, it's the time where you detoxify. There's actually a lymphatic system in your brain called the glymphatics that is gravity kind of fed. And so what we're finding is that when you lay your body down and you put your head down for the night, that it changes the venous flow and CSF flow and toxin flow out of your brain, and it actually makes it drain better. So this is one of the things in osteopathy, when you're doing cranial osteopathy, if we can improve blood flow and CSF flow and balance within the head, then we're gonna like equalize out that lymphatic flow, which is one of the things that osteopathy helps if you're not a great sleeper. And so those quantities of sleep are really important. And we're going to come back to this multiple times. But one of the biggest reasons that I think it's extremely important on many, many levels for children to be able to sleep independently, like not sleep with their parents on the way to bed.
On my list. Do not worry. I have that question.
And I don't mind if children like have like a bed in their parents' room, or they some families kind of have a family bedroom, and that's fine. But they need to be able to fall asleep independently. And that ties into a couple other things I'm going to talk about too. But the biggest reason is when they don't, my experience has been they don't get enough sleep for their age. Because if a parent's sleep quantity is 8 hours a night and they have things to do and they want to like do their laundry and talk to their friends and maybe hang out with their husband and watch a movie and whatever the things adults do, they actually need some time when their children are awake also, like for their own quality of life. There's like kind of magic in that, God designed us to like sleep less than our children, like good night, child. I have some time for myself. So that's important. But also people tend to like put off going to bed because they're like, okay, well, I need to go do these dishes first, or I need to finish this phone call with my mom, or I need to do this, or I need to do that. And the child's bedtime gets pushed, and it's not consistent. And then we get the melatonin problem. And we really struggle with children going to bed when they should go to bed, which is, 7, 8, somewhere around there, depending on, their nap schedules and stuff if they're preschool. And their parents who maybe need to go to bed at 10 or 11. And so we're looking at children who just don't have steady bedtimes. If they can fall asleep on their own, which is going to be like really, really important as we talk about this sleep hygiene. If they can fall asleep on their own, then their parents can have a bedtime routine, put their child to sleep, walk away, go do adult things. This is important. They might be important things. They might be not important things. Although I would argue maybe the not important things are good for self-care. And then the child falls asleep independently, whether it's in their bed or in a bed next to their parents or in the middle of the adult bed, whatever that family decides to do, the child needs to fall asleep independently. And then they can go to bed earlier and give their parents adult time.
And I think it's so important what you're saying about co-sleeping and kids falling asleep by themselves. And I think it's very fascinating. There's an author that I follow, and he says, how much hours of sleep does someone need? Or why do we sleep? We sleep to wake up rested. So meaning, if you're having to wake up your kids, chances are they're not getting enough sleep. So what we want for all adults in cases is to wake up before your alarm clock. And if your alarm clock wakes you up, you did not get enough sleep, and maybe because of your quality's not there or other things. But if you have trouble waking up your kids up every morning for school, chances are they need to go to bed earlier. We need to improve their sleep hygiene.
Or something isn't right.
And something isn't right. Let's talk about sleep hygiene now, the big picture of this. And maybe we break it down to categories or age groups if you want. Some more people have responded. Tina has a 17-month-old. Alyssa has a 4 and 7. Jillian an 8. John an 11. Mary has a 5, 7, and 2.5. Those would be grandkids. Robin has a 4-year-old. Catherine has a 7-year-old. And Amy has an 11-year-old. So, but I want to let you run away with sleep hygiene and what you like to talk about.
Maybe this is the right time to talk about it or not, but I think one of the biggest problems I watch when I'm taking care of patients is, and it's not just about sleep, it's actually a parenting psychological state I've seen that's going on in the population as a whole. Maybe in my population, I don't know. But I think that there's been, throughout humanity, lots of reasons why we parent shame. So, if you live in an ancient karma system, like the problems you have are like something from a past life that you didn't do, so the reason your kids are messed up is still your fault. And if you believed in some sort of religious thing, like with possessions, like your kid might be possessed with the devil because you didn't pray enough, or you weren't good enough, or you didn't pray enough penance. Then there was, maybe you drank too much, maybe you ate the wrong toxins. I mean, even the functional medicine world can get real into that. Like the reason your kid is like this is all these terrible things you did when you were a parent, which makes me really upset because it's just not a healthy way to address a problem. And then, now psychologically, it was like the psychology community just were like, well, we don't want to call it a religious reason. So now we're going to do this like psycho mumbo jumbo where all your problems in life were your parents' fault. So a lot of people have been going through therapy for years for what they were messed up with. And they have been processing for years their problems through the lens of what their parents did wrong. So now they're having children. And I'm watching a lot of my families really, really struggle with worrying they're going to mess up, worrying they're going to be too mean, worry their children aren't going to like them, worry that, they need to let the child kind of run things because they don't want to tell them what to do. And I really think that is a major problem from parenting from a wide range of reasons. Because children really do look to us to help them, guide them through life. Like people say children are born nice and they learn bad things. And I'm like, you must not know very many children because children are kind of born jerks and we have to teach them kindness, really. I mean, they're kind of born very innately kind of selfish and they just want to do what they want to do. And we have to teach them the things that are important. So the idea that children can kind of guide their lives is not a very good one. Parents really need to help them and provide the structure that they can function in. Sleep is part of that, right? So what I hear a lot is families saying like, how do I get them to sleep on their own without ever crying or ever being upset? And I just have really bad news for everybody. Like that's just not going to happen. Kids are not going to one day just magically sleep through the night. That's not going to happen. And the ability to work towards sleeping through the night can happen in lots of different ways. It really best happens if you start when you're an infant and you put them down awake and you let them learn how to fall asleep on their own. The reason why falling asleep on their own is so important is part of our sleep architecture is that we go through these sleep rhythms, right? It appears to you, maybe if you don't understand sleep, that you go to sleep and then you just stay asleep until you wake up in the morning. But that's actually not true. You go through these cycles of an hour and a half to 2 hour cycles where you go through shallow sleep and REM sleep and dream sleep and deep sleep. And the deep sleep is your restorative sleep where you really heal and get rid of your toxins and like rest your brain. And like the REM sleep and the dream sleep is all, how you process all the things that happen during the day. So, there's different stages of sleep and they're all very important. But every hour and a half to 2 hours, you come back up into shallow sleep and you're almost awake. And so then you have to go back. And what happens is parents come in and they're like, my child wakes up every 2 hours. And I'm like, yeah, they don't know how to go to sleep on their own. So, it is almost always that children will kind of wake through the night in these every 2 hour cycles, every hour and a half, 2 hour cycles, and they'll want to nurse, or they'll want to snuggle, or they'll want to like rub up against their parents, because that's the way their brain thinks they go to sleep. That's what they've been doing. You've been snuggling them, you've been letting them nurse, you've been letting them hug with you or snuggle up to you in the bed. And so they just do what they're used to. Sleep hygiene is like habits, and their habit is that we touch mom, we talk to mom, we nurse mom, whatever. And if they don't know how to go to sleep without those things, then they will just look for them. And they will continue to look for them until you tell them that they can't do them anymore. And so I know everybody's always wanting to find some magic book that teaches them how to do this without ever making their child disappointed or upset. But I like often to say in my office, like, welcome to parenting, where you will piss off your child on a regular basis for their own good. And, this is one of the first steps of parenting, where we say, I know what's best for you. I know that you need to sleep. I know that you need to sleep solidly and soundly. And so I'm going to disappoint you. Like, something here is going to be not what you want. And there's details in how we can do that and how we accomplish that. But at the end of the day, they really do need to lay without touching other humans, with the lights off, and have a period of time where they learn how to go sleep on their own. And that way, when they come into shallow sleep in the middle of the night, they will say, oh, I already know where I am. I'm in my bed. It's dark. And they go back to sleep again. So if they can't do it the first part of the night, they're not going to be able to do it in the middle of the night either.
And that makes sense. So Jennifer Barton is asking, she has 2 kids, 4 and 6. She or her partner ends up sleeping with them through the night. So it sounds like maybe as an infant, they weren't able to teach them, or however it happened. So now what do you tell a mom or a dad or a parent saying that now they're so used to snuggling, they come to my bed every 2 o'clock to snuggle because they got up during that time. So what do you tell that parent? And I think you and I were talking about something called firm parenting or something. But yeah, so what do you tell that parent now the kid's 4 and 6 and now they're used to this?
Yeah, so I think there's a couple different kind of categories in this situation. So there's families where, and this happened with a few of my kids too, where once in the middle of the night, maybe at 3 o'clock in the morning or something, they would come in and they would lay with us, and everybody, mom, dad, kid, would go right back to sleep and sleep really well through the rest of the morning, and everybody would feel rested in the morning. And if everybody feels rested in the morning and it's all fine, and we're not kicking each other and disrupting each other and all combobulated during the night, then that's not necessarily bad because everyone is sleeping well. What is different is when we aren't sleeping well, right? And so, every family has kind of a different rule over whether you can come in the middle of the night at some point and lay with me. The reason why I like them to fall asleep independently is because of that issue of they oftentimes don't go to bed on time. If they don't sleep on their own, they don't go to bed on time. And then so once parents come in and ask me about whether their children have a medical reason for not sleeping well. And that is a really good question, because I do think there are plenty of actual medical reasons why children don't sleep well. And we can go into that a little bit in a little bit. But the problem is they will look exactly the same. So the drama of a child who's accustomed to sleeping in a certain way is very dramatic. They will cry, they will throw a fit, they'll run back and forth, they'll beg this, it'll be very dramatic. And they're not being manipulative. It's not like they're waking up and saying, like, I'm going to try to control my parents. They're just doing what works. So if screaming in their crib till they turn purple and look ridiculous works for you to come and take them out, they will continue to do that. So they're not trying to be manipulative. They just are doing what works. There's many different ways to break that habit. I have families who are like, you know what, I'm just going to put them in there and let them cry. And a child that does cry it out method like that, all alone by themselves, cry it out, just have, your time by yourself. A typical child will do that in 3 to 5 days.
Wow.
And
That's short.
it's pretty short. Their first day is really, really dramatic. The second day is better. The third and fourth day, you're like, oh. And I've had so many families who have tried, like, I get the, like, shared secrets of tired parents. So people are like, I tried this, I read this book, I did this book, I did this book, I did this book. And then we let them cry it out and they did it in 3 days. And I'm like, yeah, that's kind of what happens. So if you do it, that way it will be quickly. And then other parents are like, I just can't do it. That breaks my heart. So they'll sit in there and kind of hold their child's hand. Sometimes that actually takes a little bit longer. You really shouldn't bring them out of the crib or rock them. You still should leave them in their bed and like say, no, I'm going to stay here and you're going to fall asleep, but and they might cry, but you're there. And I think that's fair. And so I have families who have different versions of the way that they do that. The important thing, though, is when you're trying to break them of sleeping while touching another person or that other person nursing them or rocking them or telling them a story for longer than a 10 or 15-minute window, then you really should not do those things. You can be present, but let them do it on their own. So you have that like sleep hygiene of like, you have a routine, whatever your routine as a family is, but that routine should be 15, 20 minutes, whatever your family thinks is reasonable. And it should be concise. It should be the same every night. So don't let the kid be like, one more story, one more story, one more story, so that you start bedtime at 7:30 and you want to be asleep by 8. And then you stop whatever the book reading and stuff is at 8. And you're like, okay, now it's it. Like the lights are off. We're going to like sit here and I'm going to go to sleep with you. I'm not going to lay with you. I'm not going to rub your back. I'm not going to sing. I'm like, once we pick the time we're going to sleep, we're going to do it the same way every day. And that's really important. If you do the work, which is the first step, because people come in and they're like, all these things are happening, my child, but they've never tried to get their kid to sleep independently. I will not be able to tell the difference between an organic sleep problem and a hygiene problem. It's just impossible. You just can't do it. And so if you've tried that and you've really worked at it, and one of my daughters is like that, like my other two sleep trained, like awesome. And she was almost 4, and I actually had already gotten the younger brother to sleep on his own just fine, and the older sister slept on her fine, and this middle one was 4, and I was like, you know what? This is just you. Like, there's something wrong with your chemistry because we are doing all the things right, and you still really struggle to fall asleep. And that's kind of back to that, like not making, I wish I would have understood the melatonin thing for her. She was one of the kids that kind of taught that to me. Because I thought, by definition, a sleep induction disorder is that you have good hygiene, you do the same thing, and you put your head on the pillow and you should fall asleep within 15 minutes of attempting to go to sleep. That's what sleep doctors will tell you. And if you're doing all the things you're supposed to be doing right, and your kid just lays in bed and tosses and turns, and I'm hungry and I'm this and for an hour, they have a sleep induction disorder. So how do we fix that, right? Like, do we fix it through melatonin or do we fix it through dietary changes? But that's like a kind of complicated web that we can like work on. But you really have to fail sleep hygiene for me to know that we need to investigate a medical route.
Yep.
If you haven't attempted good sleep hygiene, like none of the other things will work. And so I even have families who say, like, I think their stomach hurts, or I think they're teething, or I think they have this, or I think they have that, or I think they have a food allergy. And I will almost universally say, if you haven't tried sleep hygiene, we have to do that first, because that's 99% of all of our sleep problems is sleep hygiene.
And so do you have a handout on sleep hygiene or something that that we could share with people?
I don't really. That's a good thought. We talk about it a lot.
Yeah, no.
In the office, we certainly talk about it a lot, but no, I haven't put together any sort of hygiene.
If you are able to, or if you ever do that, let me know, and we'll pass that along.
Okay, great.
I have a question from Catherine that her kid is 7. They wake up early no matter what time they go to bed. Any thoughts on that?
Well, children who have a very robust, strong cortisol response, that part of their hygiene is that they release it at the same time every day. Now, if they're releasing it at 6 and you're like, wow, that's early, that would be somewhat normal for the sunrise and sunset kind of cycles of our Earth. If they're releasing it early enough that they're waking at 2 or 3, then I think we need to look at metabolic things for why they're doing that. So sleep hygiene is such that you should wake and sleep at the same time every night. So when people say, well, I'm going to go to bed at midnight and I'll make it up by sleeping in, it's really just not quite the same. If your normal bedtime is at 10, your body doesn't have the same quality of sleep when it's off of its regulation. So even if you can convince them to go back to sleep because they were up late, it's probably not going to be the same kind of sleep. Any mom who is a real sleep tiger, which I was with my kids, will know, like, I let them stay up from time to time, but I just knew I was going to pay for it the next day. They were going to be grouchy, they were going to be dysregulated. And that, families who bring in children to me that have behavior disorders, part of the issue is that there's a lot of chicken and egg discussion there. So children with neurochemical problems, detoxification pathway issues and inflammatory issues and neurodevelopmental issues, will also struggle with those sleep rhythms. So if you were to actually do a sleep study and look at their EEGs, it is disrupted and it's not normal. So having a child that struggles with a long list of medical reasons sometimes also doesn't sleep well. So that goes back to the kids that sometimes fail sleep hygiene. But then also, if they don't have good sleep hygiene, they will present with a long list of problems. And for me, like, I don't even want to talk about your child's ADHD or anxiety until they're sleeping, because it is so disruptive to your brain function during the day. And then as a mother, if you don't sleep well because your kid is kicking you and crying and fussing and doing all these things that we need to fix, then you don't have the ability to be a good parent. I mean, all of us know if we don't sleep well, we don't think right, we don't organize our day right, we lose our temper easier. And those aren't good parenting dynamics. Children need us to be the calm, okay? They're the whirlwind little Tasmanian devil, like my frontal lobe doesn't work and I don't know the rules of society yet and I'm bouncing around and doing all sorts of sometimes naughty, crazy, dangerous, whatever things, right? And we as parents really need to be like not too anxious and be like, okay, it's normal that you're trying to, put the cat, down the roof or something, I need to not freak out, but I also need to make sure I'm clear enough to get you to not kill the cat, right? So we've got kids that make mistakes and we have to be the thing that keeps everybody safe, emotionally safe, and have their boundaries and rules around what they're going to do. And if we're scattered and we're anxious and crying and inattentive and unable to put two thoughts together because we aren't sleeping well, the whole house will go down in flames. And so a lot of postpartum anxiety is related to sleep. I like to call it postpartum neglect because I feel like society used to help moms more, and they're like home alone doing this whole thing by themselves. They never want their baby to cry. And, they really just, moms need to sleep. They really do need to sleep. And I think all of those decisions go better when a mom is well rested.
Absolutely. And Carine said a couple of great things there that I want to make notes of. So if people assume that adults need 8 hours and we went over kids need different timing, if someone goes to bed at 12, wake up at 8, versus go to bed at 10, wake up at 6 is not the same thing.
No.
Body goes through different transitions, and the body's really starting going through different transitions starting around 9 or 9:30 till 6 o'clock. So that's something really critical for both adults and kids.
Yeah.
Now, Amy's asking a question and this is a great question for both adults and kids, but Amy has a child that's 11-year-old that gets stressed because of school stuff. She was a great sleeper, now not a great sleeper. So, and the stress is increasing. So let's talk about what we do for adults and kids about if there's higher stress. I think number one is to work on it, figure out how do we thrive in life with the changes, whether we go from middle school to high school or elementary there, but how do we work with stress? There's always going to be stress in life.
Right.
And when we see stress causing sleep issues, we find it's high cortisols. We find many times it's low GABA or lower serotonin. And so sometimes we give them supplements to help them sleep better so that they're able to work on stress. And so it goes hand in hand.
It really does.
And then one thing that we found really helpful in our clinic has been something that we call sleep writing. And this goes for more of the older kids, kids that can write, and the adults. What we talk about is that if your brain is thinking before bed and taking you more than 15 minutes to fall asleep, then it's really then to write down all of your thoughts on paper. All the thoughts you have, write on paper, get out of your brain, then you're able to fall asleep easier and stay asleep easier. So I think that's a couple things for both the 11-year-old and for adults. Now, I want to talk about, so Catherine says, as an adult, I hardly ever get 8 hours of sleep. And Catherine, I think we touched upon this, that getting the 8 hours, and 8 is not the number either. Everyone is different. 8's an average. It's not even the median. And so whenever you wake up without an alarm, that's how many hours you need. And if you have multiple symptoms, you might need 8, 9, 10, 12 hours at some points for short term, and then it goes back down as you get better and better. Now, we have a question about, we have about 15 minutes left, so we have a few questions here, so maybe we'll go these a little bit quicker. But we have sleep and autism. And any couple quick thoughts about that?
It's like a whole discussion, right?
Exactly.
But I will convey a really funny conversation I had. I was talking to a colleague of mine who's a specialist in autism at children's institutions. And they wanted to do a study because constipation and GI problems are very related to sleep. And just so people understand that we have two systems in our body. One's called the sympathetic system, one's the parasympathetic system. These are actually peripheral systems that are not in our central neurotransmitters, and they are our fight or flight response. So when you're being chased by a cougar, you go into your sympathetic system and you can hear more, smell more, you're more alert, you can process lots of information at once because you don't want to be killed by the cougar. And you're like, heart rate goes up and all of the things, and your eyes are really wide and all of the lots of movement. But you're supposed to be in sympathetic for short periods of time, and then you're supposed to come back down into parasympathetic, which we refer to in biology as rest and digest. And that's because it is in parasympathetic state that you digest your food. So we do a lot of our actual bowel motility while we sleep and while we rest. Well, of course, autism brains are very dysfunctional on the pro-sympathetic side. And so they tend towards constipation on a normal state of being, and you should assume they will be constipated. If they aren't constipated, then we really have a GI problem, because that is a typical state of being for autism, is constipation. And you should quickly not assume that we need to just change a whole bunch of diets and things like that. Sometimes they just are going to need a softener, like to keep them pooping, because that is like number one for detoxification. So if you don't poop every day, you must accomplish that in any way you can. And that will disrupt sleep sometimes just because their body's trying to move the bowels and it's too hard and they can't get through. But I go back to my story. He was like, I think that if I could just fix their sleep, their GI problems would get better. And I was like, well, I mean, I suppose that's a great idea. I was like, well, what are you going to do to get them to sleep? And he goes, well, what do you do? Maybe we can test what you do. What do you do to get them to go to sleep? And I go, I fix their gut.
Good.
And so, I think that sleep hygiene, of course, is important, but a lot of autism kids do fail sleep hygiene. So this is a good example. And like the other mother that said that her child used to sleep well independently in her bed and doesn't anymore and was having anxiety. In our office, we look for biochemical reasons for the anxiety as best as we can, because a child who accomplished good sleep hygiene and their parent-child relationship was appropriate and declined in their sleep hygiene is always a red flag to me, like something is going on here. You need to do something about that.
So,
and same with the autism kids, like they're gonna a lot of times fail sleep hygiene. You still have to do it. Like you still have to, just like children who are nonverbal spinning in the corner, very brain dysfunction, still get their behavior control through like expectations and no, you're not allowed to hit anyone, and no, you can't smear stuff on the walls. Like, we just consistently come back to behaviors. There still is a biochemical reason, right? So when we're working on the biochemistry of a child with autism, I am trying to accomplish those goals. The thing is sometimes it's very difficult, just like autism is a complicated brain disease. It's not as easy to cure as some people may promise. And so we use a lot of valerian root for sleep maintenance. So people will get these confused. Melatonin will not help you stay asleep, and valerian root is mildly helpful to falling asleep. So if we have kids that are waking all night, a lot of times we use valerian root. If we have kids that have trouble falling asleep, then we start with melatonin, and we will do other things for those things. If we fail those basic managing constipation, working on gut flora, working on, your biochemical pathways with your methylation cycles and stuff, if we're still not sleeping, then we start to work on supports that work on sleep specifically. But I usually work on the biochemistry first.
That makes sense. And so I hope that was a question from BAMC. So I hope that gives you a little sense that if you haven't been working on the gut for your autistic child, that may be something that you might consider. And then it looks like that there's a workup that needs to be done to help figure that out also. Now, here's an adult, and this, I'm not sure this applies to kids too, but is there a better position to sleep in? On the belly, on the side, on the back? And I'll answer from the adult perspective, and then please answer from the pediatrician perspective. From the adult, I think that I have not seen data one way or another for adults. Some people do better on their sides. Some people do better on their back. Now, if people are obese, then the back may not be the best, especially if you're a snorer. The abdomen, some people sleep on. I think that's probably less ideal on the abdomen overall for adults. So either the back or the side is what we have found to be for the adults. But now let's talk about kids, and probably there might be a different answer for different age groups.
Well, we know for infants, if they're in the hospital and they have actual reflux where they're having heartburn and spitting up, laying on their right side or laying on their abdomen is better. Because we have the very strong Back to Sleep campaign, we are not recommending children sleep on their belly, although we have some new mattresses that allow children to sleep on their belly, which I'm a big fan of. The pediatricians were kind of mad when they didn't make an exception for reflux babies in the Back to Sleep campaign because they do sleep better that way. I don't think we have a lot of data aside from reflux when you're laying on your right side to help your stomach empty of positions. I do think it's important to not contort yourself into weird positions. And most children sleep like pinwheels. I mean, they're all over their beds, and that would be normal. I have parents who ask me about their kids moving a lot. I also noticed in the chat group there was a woman asking about kind of night terrors. Those are like actual sleep disorders, and we do sleep studies for those. So children that have really bad nightmares and they don't remember them in the morning and they thrash and turn, we do usually get sleep studies for those.
Excellent. Here's a question. What if a child is fighting at nap time? They don't want to take a nap.
It would depend on the age. I mean, some children are outgrowing their nap needs because they're getting good sleep at night. Depends on the family. I had a family who asked me about their child not taking naps at a really young age. And then I found out that the mom was keeping her in bed for like 16 hours straight because the parents had like a shared shift, like different shifts. And so they were nursing the baby, but they were keeping her in bed. And then as she got to need less sleep, she didn't know why she didn't want to stay in bed that long. That was kind of funny. So, I mean, sometimes they sleep a lot at night and they don't nap, even though they're kind of a napping age child. Other times children are outgrowing naps just kind of naturally. And I do think a lot of families and daycares like really value that they need to lay there and read a book or do something for some quiet time if they're in that tweener age between like 3 and 4.5, that maybe they're kind of outgrowing their naps, but not great because sometimes they'll sleep sometimes and they won't sleep other times, and that's fine. And teaching them to have independent play is important too. So even if all they do is sit there and act quiet and you're like, you can read a book, you can play with your doll, you can do this little, lacing game or whatever, but I want you to stay in your room and have some quiet time. I think there's some value in that even if they don't sleep.
Yeah. Here's a question in the chat box. There's a lot of technology out there. Do you guys use any tech for sleep?
I wasn't, it cut out what you were saying.
Do you use any technology for kids and sleep?
Like devices?
Absolutely. There's a whole bunch of stuff out there, in the whole tech world.
The only thing that we sometimes use is the sleep lights, that look like a setting sun. Those are really nice. I have a lot of families that their kids will listen to books on tape because it's just enough to keep them calm, particularly for like a anxious or ADHD kid who needs their mind to be working. You definitely don't want any iPads or devices or lights or blue light screens or anything like that on. So TVs and devices are definitely no. And then, there's other just good wellness issues from, brain mapping and things like that we can do. But those are probably the backbone, at least for me, for kids.
Yeah. For adults, one of the things that we're using in our office is PEMF. And we're finding that there's a PEMF that can help with the different cycles of sleep. Like how you talk about the 4 different cycles and how you want so many cycles a night. And so for adults, that we've used some of the PEMF to help with that, which has been amazing.
Yeah.
Now,
grounding mats are often known to be helpful. The other thing, I just reminded me, it's a little off topic, that a lot of people don't know about moms and nursing babies is like women who live in the same home will have their periods at the same time. Women sync their sleep cycles with their babies. And so when women sleep in the same room as their infant, and if we're trying to teach them to sleep independently, it's best if that's in a bassinet next to you and not actually touching you. But if you sleep near your infant, you will sleep on the same sleep-wake cycle. So a lot of nursing moms who sleep and nurse through the night with a newborn will say they don't really feel that tired in the morning, even though they got woken up every 2 hours. And that is because that shallow sleep comes up together and you nurse a little bit and then you go back down and then you come back up and you nurse a little bit, you go back down. And so the bad thing about that is sometimes it gets us into this rhythm with our newborns where we don't mind it too much. And so we let them co-sleep. And there comes a point in almost all of the moms' lives where they aren't okay with it anymore. And for each of my children, like, because I was a working mom, like I kept them in my room and they slept close to me and I nursed them all through the night and helped with my milk supply. And that was fine. But there was a point, and it was actually a different age for each of my kids, where I was like not okay with it anymore. And, and I felt like, you need to go to sleep. I need to sleep. You need to sleep. We all need to sleep. And I think that when I talk to parents in the office, I think that really coincides often with the time in which they really are learning those skills where they could put themselves to sleep. And we need to listen to our intuition on that and be like, oh, it's time. It's time for you to do this. And the best I can align is if you've ever watched like a mom puppy, a mom dog with her puppies or a mom cat with her kittens, that they will sleep with these like 6 puppies like crawling on them and nursing, and you're thinking to myself, how does she sleep through this? Like, she just looks like she's so relaxed and so comfortable with these babies like all over the top of her. But when they hit weaning age, when they are 8 weeks old, it is like a switch, and that mom is not nice anymore. And it's really interesting to watch, right? Like, she growls at them, she nips at them, like, go over there, sleep in your own space, stop nursing, like, go away from me. And I felt like that a little bit with my own kids. And I thought to myself, like, I think that that's a mammalian thing. Like, we're done here. You don't sleep in the middle of the night anymore. You don't eat in the middle of the night anymore. And, that can be different. Babies usually by about 2 to 3 months of age have a lot of chub, and your pediatrician really needs to tell you whether your child is ready to sleep that full 8 hours that an adult should be sleeping. But if they have all that chub and they can hold their blood sugar and they can make it 8 hours, then they should be. And we should work on getting them to do that. And we shouldn't feel guilty that we feel like we need our sleep. Because again, good parenting needs it. And other mammals do that. Other mammals tell their babies no. And so we shouldn't really feel guilty about that.
Well, one of the things that, which was great, was the idea of grounding or earthing. So humans are meant to be barefoot in grass. And the data is probably at least 1 hour a day. And so guess what? If you go barefoot in grass or soil or those things, and you're outside, guess what? You're getting the sunlight you need, you're lowering your melatonin, you sleep better at night, and you're also gonna get the healing energy of this idea of grounding, earthing. If people haven't read about it, please Google it and read about it. And there's earthing sheets, grounding sheets.
Right.
And those, and I use one. I've used one for over a decade, and that helps lower inflammation, helps lower stress, and also lowers pain. So you're actually getting better quality of sleep. And again, we talk about sleep cycles. You're getting better sleep cycles and deeper sleep. So, and we've had great
And
results.
that reason, I hate to interrupt you, but the reason why grounding works, some of us know it, but don't always remind everybody, is that the earth is a really large magnet. And actually, within all of our cells, remember our water molecules are like those little triangles. And we're actually supposed to orientate and polarize with this grounding magnet of the earth. And a lot of our energetic signals in our bodies and stuff are relied on this like polarity that our bodies have. And you, being barefoot is good for a long reasons, but also just being outside in the dirt and being away from electronics, being away from EMF, being away from a lot of metal and concrete that disrupts a little bit of that polarity that occurs in your body. And the grounding mats can overcome some of that from, because of course it's everywhere. We can't avoid it. It's in all of our buildings. It's on our electricity. Everything has charges to it. And so when you lay on a grounding mat, it accentuates what would naturally happen with the earth and helps us overcome the fact that we were a little disoriented through the day.
Yeah. I think we have, well, time for one last question. There's now something popular called those heavy mats or weighted blankets. And just like 1 minute or so on your thoughts on those for kids.
So certainly children who have like sensory abnormalities, common in autism and very common in anxiety. So sensory abnormalities are part of that sympathetic nervous system because your response, like that being chased by a cougar, like you hear things differently, you feel things differently, your body kind of sometimes feels disconnected to itself. Sensory abnormalities sometimes get labeled as their own diagnosis, which is, I think, a little bit not quite right. It's usually along with some of the other biochemical, like anxieties or autism or something like that. It's usually coming along with that. But some patients feel really good with the deep pressure on their joints and on their proprioception of their body, and it actually causes calming. So ironically, sometimes autism kids who look like they're fighting you, you restrain them a little bit, almost like putting a child in a car seat. And you kind of lay your body on them sometimes and they go, yeah, they just kind of melt. That's why the babies like to be swaddled. They're fighting their swaddle. So people think they don't like it. But the fighting actually puts pressure on their joints and it's actually what causes the calming. So because a baby is fighting a swallow doesn't mean they don't like it. You should let them settle for a minute in it and see if it calms them down. Obviously, if they're fighting it for 15, 20 minutes, they don't like it. But usually they kind of fight through the beginning of it and then they're like, and so weighted blankets can do that same phenomenon to kids that are older. And for some patients, that's really great.
Yeah, and then in terms of adults, um, I'm seeing patients anecdotally say very good things about these heavy blankets or these weighted blankets. I've not used it myself or seen the research, but having good information about that or good feedback from people who are doing that.
It can be really simple too. Like we keep our air conditioning low, like cool in our house because I am a big heavy blanket person, and I use these furry blankets from Pottery Barn on top of my down comforter, and I like snuggle myself in like a weighted blanket. And it's not a fancy weighted blanket, but that weight is definitely something some people really enjoy sleeping under. Which can get hot.
Absolutely. I want to really say thank you, Dr. Carine, for answering all these questions. And I think one of the big things that she said, which is really important, is that parents have to take care of themselves too, and that we got to make sure the kids sleep and not feel guilty for being a parent and doing what it takes for them to learn how to sleep properly by themselves and through the night.
Yeah.
And in the chat box, I put Dr. Carine's website for her office. And then also I put my website for our office. If we can be of any help, please contact her office or my office, and we'll be glad to help you guys. And again, I really appreciate you giving us all this awesome knowledge today. It was great.
And I just want to like end that in saying that we're all on a journey in our lives. You know, we have like our own spiritual paths that we go on. And those spiritual paths are an area of personal growth, and being a parent is one of the most powerful growth paths that you can have. And sometimes you find in yourself things that you didn't realize, right? Insecurities. Am I not a good parent? Am I going to mess up? Am I not going to do it right? And we really need to work through those, and we need to like give ourselves grace. But the biggest mistake any parent makes in my office is in assuming that if they make their child upset, that will be bad. But life is full of a lot of disappointment. And so the children whose parents don't allow them to be disappointed at times, I've watched those children grow up now. I've been in practice long enough that I have children that have reached adulthood, which is like really crazy.
Right.
And I've watched different parenting styles, and I didn't have a strong opinion about them when I was younger. I had a very laissez-faire hippie mom, and you know, I always was like, whatever, people do things different. But now that I have watched children grow up over that arc of time, not all children will ever behave the same way by the same parenting, because kids are all unique. But I will say that children who people were afraid to make upset, they really struggle when life hits them and is true. Like it doesn't take long for you to realize you can't control your surroundings. And if they could control their surroundings for a good part of their childhood, 5, 6, 7 years of their life, and then they come up into life and they can't control their surroundings, they really don't handle that very well. And you see a lot of anxiety, a lot of depression, a lot of frustration in children who had never been disappointed before. And that's not real life. So as a parent, it's like hard to watch your child be disappointed. And that could be true about sleep, and that could be true about something else. But at the end of the day, like you really know what's best for them. And I always say, welcome to parenthood, where you're going to piss off your kid every day for their own good.
We will leave that as a great note. And I would thank everyone for coming. I hope you guys got something out of it. And in the chat box, if you can say thank you to Dr. Carine, I know that she'd appreciate that. And we are going to be having a recording of this. And for the people that weren't able to hear all of it, then Dr. Carine, you can send it to your people, this recording, and post it on social media if you wish. And then we'll do the same recording here for people that want to hear it again or want to get more feedback. So thank you again, and have a great evening.
Bye.
Bye.